Hello and welcome to my osteopath, Judith. In clinic, we treat a lot of expectant mums who present with a wide range of issues during pregnancy. In this video, I'm going to address lower back pain and demonstrate how osteopaths help diagnose and treat lower back pain in pregnancy. In my upcoming osteopathic videos, I will address some of the other issues associated with pregnancy. So click that subscribe button to stay informed and press the bell to be notified. As you will see in this video, I had the pleasure of treating an expectant mother during 2 of her pregnancies. One video is when she was 8 months pregnant and the second pregnancy when she was 6 months pregnant. Along with GPs, midwives, nurses and doulas, osteopaths are here to help you on your pregnancy journey. As a baby grows and the uterus enlarges, the mother's body adjusts to support the increased abdominal weight. This extra weight requires the muscles of the back to work harder and alters the natural curves in the spine. Postural changes of the lower back impact up through the spinal column, which can contribute to headaches and neck and shoulder pain. Any previous back problems or unresolved injuries may contribute to difficulties in accommodating the changes during pregnancy. Osteopathy during pregnancy can ease the effect of these changes on your body through the different trimesters, therefore getting your body as mobile as possible for the demands of labour. As a primary healthcare professional, seeing an expectant mother for her first consultation involves taking a detailed case history to get as much information about her lower back pain and pregnancy as possible. This will include medical history, exercise regime and overall well-being. To ensure it's safe to treat the expectant mum, we go through a detailed examination involving reflex testing, mobility testing, palpating the muscles, making sure there are no underlying issues that need to be investigated further. During the examination, I assess the patient's range of movement in her lower back and I palpate the muscles in the area of discomfort while assessing the impact of the rest of the body. The spine is designed to support and maintain balance and keep the head upright. It is flexible, allowing movement through the spinal column. Postural and hormonal changes during pregnancy may cause lower back pain, and the body may be more susceptible to injury. If a patient presents with lower back pain, it can affect above and below the areas of concern, so for example, the legs or shoulders. As we begin the treatment, we use a pregnancy pillow which allows the mum to be treated safely on her front. Expectant mothers love this pillow and find treatment in this position to be extremely comfortable. The design of the pillow means you can lie on your front without any pressure on your bump or breasts while taking away the risk of bump compression. During pregnancy, the body also produces the hormone relaxin, which helps the body prepare for childbirth. One of the effects of relaxin is the loosening of the ligaments throughout the body. Making the body more prone to injury, I can easily treat the sacrum, pelvic girdle and the big postural lower back muscles that tend to be extremely tight when a patient is presenting with lower back pain. By putting an articulation through the vertebrae, the subtle rhythmic rotation of the spine gently unlocks the soft tissue of the ligaments and muscles. This will also have a positive effect on the central nervous system and the nerves that exit the spinal column that supply the muscles of the lower back that may be in spasm. If an expectant mother has lower back pain on the left, the muscles on that side can be tight and cause restriction, forcing the muscles on the right side to work harder as the body is not working as a balanced unit. So I will always treat the expectant mum both on the left and right sides. So when there is a restriction on one side of the body, there can be a compensation on the other. As osteopaths, our aim is to promote freedom of movement in the joints without restriction or pain. During the second and third trimester, the position and movement of the baby will put added pressure on the ribs, which can cause discomfort and pain in the lower back and ribs. As the baby grows, the uterus in the abdominal cavity expands. This expansion results in extra pressure on the diaphragm. The diaphragm is a primary muscle for breathing. During an intake of breath, it contracts and flattens, which produces lung expansion. And during the out-breath, the diaphragm relaxes and returns to its original dome shape. It is an important muscle as it has several attachments into the lower ribs, back and sternum. Here I'm articulating through the lower ribs, which may loosen restrictions into the diaphragm, and in turn reduces the lower back pain and eases tension of the lower back muscles. It also ensures the pelvic mechanics are moving freely, which will aid optimal fetal positioning to accommodate an easier birth for both mum and baby. The muscle groups that give most problems in the lower back are the lumbar erector spinae muscles and the quadratus lumborum muscle, the QL muscle. The erector spinae muscles are a group of muscles that extend through the vertebral column from the pelvis to the head. The QL muscle starts at the pelvis and attaches to the lowest rib. It plays an essential role in stabilising the pelvis when a person is upright and supports the core of the body when breathing. If the QL muscle is tight, it restricts the movement of the rib cage and inhibits inhalation and exhalation. Palpation along the line of the ribs affect the muscles between each rib, known as the intercostal muscles. This will benefit the expectant mother during labour, as good lung expansion into the lungs allows a good breathing technique during the demands of labour. As the pregnant woman's body and breasts enlarge, it changes their centre of gravity. This alters the posture, often causing the expectant mum to slouch or their shoulders to rotate forward. This flexion puts extra pressure on the rib cage and thoracic area and can pull the muscles into the lower back. So the rib cage, and this is where the thoracic area is. So right over to the shoulder blades and coming from the neck right down to the lower back. In this clip, I'm treating the soft tissue of the thoracic spinal column and also the muscle groups from the spine to the shoulder blade. If expectant mums present with lower back pain, these muscle groups are usually tight and overactive. By loosening the soft tissue, you can reduce the strain and improve posture. During the second and third trimester, your baby's weight on your pelvic bone may compress the sciatic nerve, which can cause a sharp pain into the leg. The sciatic nerve starts in your lower spine and travels through the buttock, down the back of the thigh and into the foot. If the lower back is injured, it can cause symptoms into the legs. If there is a restriction in the back or the hip, expectant mother's gait may be affected, and they may sometimes walk with a waddle. If the pelvic girdle is tight, it affects movement of the lower back and the mobility into the legs and pelvis. In this clip, I'm articulating the pelvis and hip. This treatment will loosen the muscles into the gluteal area, the muscles of the bottom, the hip and down the leg into the hamstring and quadriceps. As the pregnancy advances, there is extra tension and strain on the muscles that interlink between the lower limb, pelvis and lower back, as the body is trying to compensate for the extra weight. Expectant mums often report pain in the lower back, which can be exacerbated from standing long periods or from going from a sitting to a standing position, and can often experience a dart of pain into the sacroiliac joint. The sacroiliac joint pain is a common issue during pregnancy. The sacroiliac joint is formed by the connection of the sacrum and the right and left iliac bones. The sacrum is a triangular shaped bone, centrally located below the lumbar spine. Here we can see the sacroiliac ligament is being gently stretched. The hip is designed to move in flexion, extension, internal and external rotation and circumduction. By moving the hip joint through a normal range of movement, this will stretch all the muscles into the pelvis, hip and lower limb and encourage the tight sacroiliac ligament to loosen, therefore decreasing pain and improving gait. In the third trimester, pregnancy hormones slow the movement of food through the digestive tract, causing some expectant mothers to experience constipation. By mobilising the lumbar vertebrae, we improve functioning of the bowel. Pressure from the enlarging uterus, plus increased blood flow to your pelvic area, can cause a swelling and bulging of the veins, commonly known as hemorrhoids. When we mobilise the pelvic and lower back area, we also improve the drainage to the lower limb, which can reduce swelling to the feet and leg cramps. Swelling of the feet is caused by your body holding more water than usual when you're pregnant. The pressure of your growing womb can also affect the blood flow, nerve flow and lymphatic drainage to your legs, causing swelling into the ankles and feet and also leg cramps. Articulating the ankles and lower limb will improve lymphatic drainage and decrease swelling of the feet. Cranial osteopathy involves osteopaths using pressure to release tension and correct imbalances in the body by palpating the motion of the bones and the subtle rhythmic pulsation of the CSF, the cerebrospinal fluid, which we call the involuntary motion, the IVM, or the cranial rhythm. The osteopathic approach is a particularly gentle way of working with the body's own mechanisms to release and rebalance tensions. After delivery, it's advisable for the mum and baby to return for osteopathic assessment and treatment. See you in the next video, where I'll be showing an osteopathic session for neck and shoulder pain in pregnancy. If you've enjoyed this video, please share it with any expectant mums. If you found this video helpful and informative, please like, share and comment. Thank you for watching.